have a busy emergency department, you need information very quickly. So now that we have CRISP single sign-on, we have the ability to more seamlessly go into the CRISP database and be able to access information that before we weren't able to access in that way. We would have providers that may not access CRISP as often as some others, and passwords would expire, and providers would forget their passwords, have to call and get reset, and those proved to be barriers to accessing the database. The single sign-on removed those barriers. What we can do in 3 minutes can impact a patient's outcome and impact their life.
So the unique thing about our organization, we are able to have single sign-on in our pharmacy system, and once we click one button on our homepage that says CRISP, we're able to land right onto the unified landing page. On that page, we're able to see all the services that are offered by CRISP to practitioners.
We use EHR system that luckily we're integrated with the Flex button through CRISP. Flex button and CRISP, was very intuitive. Much actually simpler than accessing an EHR system. The web interface was, I think, straightforward enough that didn't really require a lot of training. The Flex button was just an extra tab that was added into the EHR. And that helps me if there are any alert behind it, if there are anything new over the last 30 days that has changed with the patient, that actually flashes and gives me certain indication, so like a care team alerts or other indications. So when I launch that tab, I get a list of institutions along with the alert that's tagged to it, and I can actually read that alert. It actually gives me helpful information of what care management or case management have documented as related to the patient care and challenges or social challenges that they had that would be helpful for me to care for that patient, especially when I'm ready to discharge them from the hospital, to know what kind of environment I'm sending them to. Having access to the Flex button and access to CRISP, I think opens up a lot of opportunities. And what I'm really hoping that this becomes a true extension of any hospital or any organization EHR, where you feel like you're not limited to what's within your four walls or what's on your server, but becomes more of a one medical record.
So with the implementation of modern technology into medicine, there's been some headaches. Electronic medical records sometimes have a lot of clicking, and it can be hard to get your way through a patient chart. There's no concerns about that with CRISP. CRISP is 100% across the board a great tool, something that we all use daily and something that we don't really remember our practice beforehand. The immediate access to this amount of patient information within just seconds of logging on is essential to the practice of the modern emergency physician.
CRISP falls right in line with the current drive in healthcare, which is to reduce cost, improve outcomes, and at the same time enhance the patient experience.
CRISP to me is safety.
CRISP is the future.
CRISP is access.
CRISP is a game changer.